Are you living in pain? Is it joint pain or muscle pain? If so, stay tuned. Welcome to Living Pain Free with Dr. Marc Darrow from the Darrow Stem Cell Institute in West Los Angeles. This is the program that can give you effective solutions for the pain you've been living with. Dr. Darrow is a medical doctor, board certified in physical medicine and rehabilitation. He teaches about the use of prolotherapy, PRP, and stem cells. Today's program could open up a new life without pain for you. Now, here's Dr. Darrow with his co-host, Nita Valens.
Welcome. Do you want to avoid surgery? Are you suffering with joint or muscle pain? Do you have arthritis, dull aches, stiff joints, and can't figure out why? Do you feel like you're slowing down and can't walk, run, or play sports the way you used to? Welcome to Living Pain Free with Dr. Marc Darrow. I'm your host, Nita Valens, and stay with us while Dr. Darrow answers these questions and more today when you call the program at 866-870-5752. You'll get a free book, and the number is 866-870-5752. We are a resource for information and education about the orthopedic musculoskeletal system of the body. And remember, call now, get your free copy of Dr. Darrow's newest book, Stem Cell and Platelet Therapy, Regenerate, Don't Operate, 866-870-5752. And now let's welcome Dr. Darrow. Hi there.
Hello, Nita Valens. How are you today?
I'm great. How are you?
I am living it up, as always.
Well, that's awesome. And we want our listeners to live it up. So call right now, get your free copy of Dr. Darrow's newest book at 866-870-5752, 866-870-5752. We are here Saturdays at 10 o'clock, again at 1 o'clock. And you can go to Dr. Darrow's website at www.lastemcells.com. That's lastemcells.com. You can email him off of every page on the site and watch him performing the treatments on videos. How about that?
I love it. So, Nita, we're going to start you off right away. Are you prepared?
Prepared.
Why don't eggs tell jokes?
Because their shells are too hardcore.
Well, that's true, but not really. They crack up too easily.
Oh, I know that's true.
When is a door not a door? When it's a jar.
Oh my gosh, that's a good one.
Give you one.
That's a good one. Okay.
You know why I do these, right? Because the audience gets so sick of them, they call in and talk to me about medicine instead.
Well, they don't want to see me suffer. That's okay. Go ahead.
Yeah. Okay, I'll give you one last one. Why don't you buy things with Velcro? It's a ripoff.
Oh my gosh. Oh my gosh. Okay, come on.
I'm going to go to a question. You ready?
Okay, yes. Listeners, please call. Call all hour.
Yeah, give us a call or I'm going to give you more dumb jokes. The phone number to get to me right now live is 866-870-5752. Get your pens. I'm going to repeat it. 866-870-5752. Let's see what this person has to say. More PRP/stem cells for hip being recommended to hip replacement. Okay. Hi, Dr. Darrow. I've been advised to get a hip replacement surgery, but I'm very interested in stem cell therapy to regenerate the cartilage in my right hip joint. In December 2019, I had a stem cell treatment using adipose. That's fat. That's like a mini liposuction. I don't do those.
Okay.
And PRP and hyaluronic acid injections in my right hip. The right hip is still painful, especially when I walk a long distance. I've seen an improvement in the mobility of the hip joint. I would like to ask if more PRP injections or bone marrow stem cells would improve the hip joint and regenerate cartilage. The answer is yes. I don't do adipose. I don't do hyaluronic acid. Hyaluronic acid, things like Synvisc, and there's 20 others, are very expensive and don't really do anything. They're a lubricant, and the joints already make them. So when we do stem cells or platelets on your joints, when studies are done, they show their hyaluronic acid is already being produced. We don't need to inject it. And then using adipose, a lot of guys use adipose. I went out to dinner with the doctor who promulgates the use of adipose, and he thinks it's amazing, and God bless him. If that's what he likes to do, he should do it. I don't think it's as easy on the patient. It's like getting a little liposuction. Doing bone marrow is very, very quick. It takes me about 15 seconds to do the procedure once I start. So it's easy, it's very discreet, it's exact, and it's simple. And that's the way I like to do it at this time. If someone can show me there's a better way, I promise I will do it. I like to do the best things for people. But right now we're getting great success using bone marrow. And the bone marrow has your blood in it, and it has your platelets and stem cells. So that's the way I have found. I've done about 6,000 of those with bone marrow over the years. And I've done probably more PRP, which is platelet-rich plasma. We just draw the blood to get the platelets, but there's very few stem cells in it. So if you want to knock out the problem, get rid of your pain in your joints, tendons, ligaments, neck pain, back pain, arthritis, whatever it is. I do inject from the top of the head all the way to the bottom of the foot and everything in between. Most people that come in, the percentage is knee pain, and then we get a lot of low back pain and neck pain, shoulder pain, hip pain, and arthritis. And we're getting real good success. As my listeners know, I've used these techniques in my own body for the last 23 years at this point. And I had a failed surgery on my shoulder when I was in medical school. And the surgery really screwed up my shoulder. I'm not blaming the surgeon. I do love that guy. It's just these surgeries don't seem to work out too well for a lot of people. I'd say half of them, it's a failure. And half of them, it looks good for a while, but then down the road, the integrity of the foundation of the joint or whatever part of the body is that had the surgery is disrupted. And then, I like this analogy. When the foundation of the house starts breaking down, the house falls down. So people come back after they've had a surgery, and I warn them, I go, don't do that surgery unless you really need it. Big question is, what does need mean? And surgeons obviously think a lot of things need surgery. And when I examine the patient, I say, I wouldn't do surgery on that. And then the patient goes and against my will gets the surgery. And then they come back a couple years later and go, my God, what happened? It got worse. And then we can help heal them up even after a surgery often. Now, I don't do any guarantees with regenerative medicine using platelets and stem cells. Nothing, no guarantees, because there's no guarantees in medicine. I have seen people die on the table getting surgery. I've seen people stroke from taking a medication. There's all kinds of problems that happen in medicine. I always laugh when I tell a patient, if you want to stay safe, stay away from doctors. The number 3 cause of death in our country is what we call iatrogenic. It means doctor, medicine, surgery caused. So try to do things conservatively. One of the most conservative things I know is staying away from doctors, and then you go in the order of things like physical therapy, acupuncture, and then when you get to issues that don't heal, then I would say instead of for orthopedic issues to do a surgery, you certainly want to stay away from that if you can and do regenerative medicine. We have a huge success rate. I do have to pick the proper patients. It doesn't work on everybody. And again, in your consent form, if you come in, it's going to say there's no guarantees. So a lot of people like to put words in my mouth. They say, you told me it was going to work. I never tell anybody anything like that. I can tell them the odds of it working, which are extremely high, much higher than surgery. But everybody is different. It's just the way it is. So yeah, I think this person can get some help without a hip replacement from what I've read here. Especially since the person can walk a long distance. That means there's good mobility, and there's probably plenty of cartilage in that joint. And even if it were worn down, we can still help by injecting into the joint and regrowing what cartilage was there If a joint is locked up, unless it's like a frozen shoulder, which we can generally help, if it is real bone on bone, that means there's no cartilage, and let's say the hip joint, the leg doesn't move at all, then we probably cannot help that. We can help reduce the pain in it, but a person would have to come in so many times for treatment to regrow enough cartilage that it is not something that is advised. I did tell someone yesterday to get a hip replacement, but I said, before you do that, you need to lose weight. And this woman was about 200 pounds. And it was very interesting. She was arguing with me about losing weight. She said she already lost 40 pounds. And I said, you know what? That's like being in the desert and you walked 40 miles to the lake where there's water, but you didn't walk the extra 40, so you never got the water. So you're still in thirst and dehydrated. So this is something you have to do enough of to get the results. A lot of people come in after one injection. They say it did not work, and I say it did work. You just haven't had enough to get the feeling of the success of it. And how many does that take? I never know the answer. Don't push me on that one. I don't have a crystal ball. It's different. I've had places on my body I've injected, and overnight they've healed. And I've had parts of my body that I've injected where it's taken a few months to get better. I like to see people after they've been treated by me with platelets or stem cells in about 2 weeks thereafter and see how they're doing. If they haven't had the success they want, I will advise to do the procedure again. It all depends on the patient. Some people fly in from different countries. I see them maybe once a year, and they still can get good results. It just depends. A lot of unknowns in medicine. No one wants to hear a doctor telling them that, but I'm not going to lie to you. I think the biggest complaint I have from patients is they go, you're too honest. I want you to be a cheerleader and tell me I'm going to get better, and I don't do that. I tell them my experience, which I've had with this form of medicine for the last 23 years. I'm going to give out the phone number because I hear you breathing.
I'm breathing.
Nita?
Yeah, sorry about
that. So the phone number, no, it's okay. I know, it's a good sign. The phone number, you can call me right now and talk to me live. We love your phone calls. Please do. Is 866-870-5752. That's 866-870-5752. And I'm going to give out the website where you can watch me do these injections. There's a lot of videos. And that's www.lastemcells.com. I'll repeat it. www.lastemcells.com. And you can email me from every single page on that website and get personal, and I will respond to you. I respond to everybody almost immediately within a day, and I would love to talk to you and find out what's going on. By the way, the failures that I see with using regenerative medicine are either that you get a doctor who doesn't know what he's doing, he's been to a workshop, or you're getting a nurse, or you're getting a doctor that chiropractors bring in for a day who don't really do this for a living. And they don't really know what they're doing. Sometimes we get doctors that don't use ultrasound on the big joints. They're not going to get that needle into the joint. It just doesn't happen. Studies show that they miss. Some people are overactive and they don't let the area heal. It actually is healing. There is tissue growing. There is new cartilage. There is no collagen. But they are active and they don't feel it for a while. Then I tell them, hey, buddy, stop doing the activity. And then within a few days, they tell me, oh, it's healed. Some people take anti-inflammatories like ibuprofen, and we guide them to stop, but they don't. And that actually blocks, if you look it up, it blocks the resynthesis of new tissue, new cartilage, new collagen. So get off of that stuff. And that's about it. I mean, this stuff works. When I pick the right patient, it works. It's worked on me 100% of the time for the last 20 plus years. But I listen to myself most of the time. Sometimes I cheat on myself like the patients do. But the easy part for me is I can go back. I mean, I'm going to be honest. I've done sports the same day after I've treated myself because I'm a sports junkie. I'm going to go out and probably go running today, lift some weights, and I'm going to play golf up at Mountain Gate. If you want to meet me up there, it's right behind the Getty Museum. And I always tell my patients, as soon as you get better, I'm going to take you out to play golf. I get tons of golfers. I get every type of sports fanatic, but for some reason, I'm a magnet for golfers. We get so many golfers that come in the office. An example, I was playing golf with a guy about 6 months ago. I'd never met him before. And he was a pretty decent golfer. And he goes, my back really hurts. So he came in, I did bone marrow stem cells and platelets on him. And he said, God, I'm all better. Can I play golf? I go, no, not that quick, because it was like a week later. Well, he didn't listen. He went back and re-injured it. And then he said, how come it didn't work? And I said, you cheated on me. I said, I told you can't do that. You got to let the tissue actually mature and grow. Some people get results right away, but that doesn't mean it's healed. When I say results, that means they feel real good. But that doesn't mean it's completely healed. So you got to listen to your doctor. Most people don't like to. We're all very type A and aggressive, and in America we do it our way. But you got to listen to me if you want to get better quick. Anything for you, Nita? Before we get to the break, I see it coming on. Oh, 10 minutes to the break. Call us now, 866-870-5752, 866-870-5752. And if you want to call the office to get more detailed information than I'm giving, I would go to 800-300-9300. There's people by the phones all the time, 800-300-9300. And there's other things going on in the office. We do hair regeneration. If your hair is thinning, we can put these regenerative cells, bone marrow or platelets into the scalp, and hair can grow back. Very simple procedure. We numb it up first so you don't feel the needle very much. And then the other thing is the face can be regenerated. What? Yes. As we age, we dry out. And a lot of the injuries or overuse that I see come in is because the body is drying out. The discs in the spine shrink down because they get dry. People actually do shrink as they age. My dad was about 6'1" when I first met him. Lita, you're not laughing, Nita.
I'm listening intently. I love when you talk about your family. I know your sister.
Donna, yeah, she's amazing. I've treated her all over. Yeah, she's had amazing success. She didn't used to like me too much, and then I treated her, and then all of a sudden she loves me now.
She always loved you.
Yeah. Brothers and sisters have their issues, right? Family has their issues.
Well, if someone's just joining us, you're listening to Living Pain Free with Dr. Marc Darrow. And this is where we talk about regenerative medicine. And if you want to know more or even see videos of Dr. Darrow performing the treatments, you can go to the website at www.lastemcells.com. That's www.lastemcells.com.
Nita, you very lovingly cut me off. I didn't finish talking about what's called the vampire facelift.
Oh, I'm so sorry. I thought you had finished.
It's okay, but I didn't even tell the word. Yeah, it's a pretty neat thing. All we do is we use a teeny needle, inject the face, and the collagen regrows. Usually by the next day, men and women feel that their faces look way, way better. I've seen it. I can't believe it. I haven't done it. I don't know if I will. My family is not a very vain family. Not that vanity is really the word I should be using, but we let our hair fall out and we don't take care of things that much. And we're more philosophers. But in LA, actually it's all over the world now they're doing the vampire facelift. But especially like LA, people want to look really super good. So they do the hair regeneration and they do the vampire facelift in addition to getting their joints, ligaments, and tendons rejuvenated using platelets and stem cells. So it's been a great practice for me. I absolutely love it. I love going into the office every day. My wife is out of town for a week. I stay at the office till 10 o'clock every night when she's gone. I force myself to leave when she's in town. I just adore what I do. What do they say about people who love what they do, never work a day in their life? And I am that guy. I'm doing this stuff day in and day out on the weekends. Here I am on the radio, right? And then I answer emails. I work on the website every day. And there's just so many moving pieces. As you folks who know me know, I'm a lawyer. I've got a master's of taxation. And besides just doing med school and a residency at UCLA, I went on to do a residency, you might say. It's a fellowship, actually. It goes on in natural medicine, regenerative medicine. That took me about 3 years. And I love education. I love helping people. So I'm waiting for your call at 866-870-5752.
Absolutely. And when you call, you get Dr. Darrow's latest book for free, which is called Stem Cell and Platelet Therapy, subtitled Regenerate, Don't Operate. It has 264 scientific studies, and the foreword is written by Suzanne Summers.
What a great woman Suzanne Summers is. God bless you, Suzanne Summers. You do so much for medicine. I think some of your bylines are don't burn it, right? That means if you have cancer, don't get chemo, and don't cut it. Do things naturally. And she's done real well. She's assisted so many people, men and women, in staying natural with their health and not going to invasive things that hurt people. So we've got a couple minutes left. I guess I should get to a chronic shoulder pain question. What do you think?
Oh, yeah, that's a common problem. Go for it.
Okay, pain area, chronic shoulder pain. How long? 6 to 12 months. Recommended surgery. Yes, I have been recommended surgery, and I'm terrified. I don't want to do it. Smart person. I'm not going to give out your name. I'll protect the innocent. But I did have that shoulder surgery in medical school when I was a dummy, I'll say, and it turned out horrible. My arm blew up like a balloon, full of fluid, and I had a high fever. That shoulder did not heal for years until I learned about regenerative medicine and injected my own shoulder, woke up in the morning 100% full range of motion, which had been limited, and pain-free. It was like the greatest miracle of my life. I couldn't believe it. I've also done my own wrist. My right wrist was injured when I hit the ground instead of the golf ball and hyperextended my wrist. That's all better. I've done both of my knees with stem cells, both of my shoulders with stem cells. What else have I done? I've had other people. I can't reach my neck and back. They've injected that for me. I'm doing pretty darn good. I can do all the sports I want to. And I don't know. It's been a magical life for me. I'm 73.
Wow.
When I was in my 40s. When I was in my 40s, I was crippled, you might say. Not neurologically, but just the musculoskeletal system was beaten to a crisp. I'd been a gymnast when I was a youngster, all through high school and some through college. And I actually did gymnastics into my early 40s until I really beat myself up badly. But I love water skiing and snow skiing, all the water sports, kite. I didn't do kite skiing, but what's it called? Windsurfing. I run almost every day. Tennis, a madman, you name it. I like to keep my body moving. It feels so good, as you athletes know. With the amount of work I do, I'm mostly a weekend warrior now, but I do run during the week. As soon as I wake up, I throw on my running shoes. I live in the mountains over the ocean, so I get to take a quick run with my dog, Bella. She's a husky. Dakota had an ACL replacement on his knee, the other husky, which failed, so he can't run anymore. So those surgeries fail on animals just like do on humans. So stay away from them if you can get regenerative medicine to help. And, ACL replacements are something I am totally against unless that knee is so loose. The ACL is the anterior cruciate ligament, and it holds up. Time for banjo and time for a break.
It is indeed. You're listening to Living Pain-Free with Dr. Marc Darrow. I'm your host, Nita Valens. Grab a pen or a pencil, write down this important information coming your way, and we'll be right back after these messages.
You're listening to Living Pain-Free with Dr. Marc Darrow. Dr. Darrow's practice is located at the Darrow Stem Cell Institute in West Los Angeles. To schedule an appointment, call 1-800-300-9300. That's 1-800-300-9300. Dr. Darrow will be back in just a moment. Stay tuned.